Hello, my name is Lisa and I am the receptionist here at the clinic. How can I help you today? You've got an appointment? Okay, that's great. Have you got your letter with you, please? Thank you very much. Okay, so you will be seeing Dr. Laura today. Oh yes, she's a very lovely lady. Very, very lovely lady indeed. You're here for a cranial nerve examination. Ah, okay, you were recently involved in a car accident and you had some concussion with that, yeah? Just checking everything's in working order with your senses, how it should be. Okay, Dr. Laura will be checking that your sense of smell is okay and your vision and also your hearing, okay? Now, please don't be nervous. I think you do look a bit nervous. Are you okay? Okay, well, I can promise you, you will not have any pain at all during the cranial nerve examination tests that we do, okay? Literally, they'll be just, painless tests and everything will be completely fine. And with Dr. Laura, she's one of these doctors who's really understanding if a patient is a little bit nervous or anxious. So just tell her how you're feeling and she'll, look after you, okay? Okay, right, give me a second. I'll just go and get her and she will start the exam for you, okay? Won't be a second. Hello. Hi, I'm Dr. Laura. It's great to see you. Thank you for coming in today. Okay, so I'm just reading through your notes here. Okay. So, how are you feeling after the car accident? Yeah. Oh, definitely. That kind of thing will really stay in your mind for quite some time. But we'll make sure everything's working how it should today, okay? You're feeling a little nervous. Oh, well, honestly, there is nothing that I'm going to be doing today that will cause any pain or discomfort, okay? So I'll be checking your sense of smell, your vision, and your hearing, okay? So please don't panic, and if at any time you do feel a bit anxious and nervous, just tell me and I'll stop, okay? We can take a little break, okay? Okay, so the first thing I want to ask you, just a few questions, sorry, and then we'll begin with the exams. But you had concussion with your accident. Has that left you with headaches at all? Or yeah, okay. With the headaches, are they like really painful? Or are they kind of copable? Okay. So some days worse than others, yeah? Are you getting the headaches like all the time or just kind of, yeah, a few times a week? Okay. Has there been any trouble with your vision at all? Okay. And is that in both eyes or just the one? In both eyes, yeah. So kind of zigzag, bright shapes. Yeah, migraine, yeah. Did you suffer from migraine before the accident, or you did, yeah? Okay. But they're a bit worse now. Okay. And when you get the painful headaches and the horrible flashing lights and shapes in front of your eyes, do you take medication for that, or? Okay, so just lay in a dark room. It's always very good to do. It can really, really help. And you take paracetamol, yeah? Ever try anything stronger, like Nurofen or something? Yeah, okay. Okay. What about your hearing? Is there anything? No, that's fine. Okay. So is there anything else you've noticed about any of your senses since the accident? Okay. I'm having trouble sleeping, yeah? Yeah. So it's the kind of trauma of it, the stress, yeah? Okay, yeah. I mean, obviously when things like that happen, it really can play on your mind, and if you're thinking about things that are stressful before you go to sleep, then that will cause you to, you know, basically disrupt your sleep. So I would really suggest some nice light meditation before you go to sleep. Read a book, you know, have a nice hot bath, just literally relax and let all those horrible stressful thoughts just, you know, disappear as best they can, and hopefully that should help with the sleep side of things. Okay, so we're going to start off with the tests now. Okay, what we're going to do first is your vision. Okay, so any cloudy kind of misty look in your eyes ever, or no? Okay. Any kind of pain at all with the eyes? Just when you're getting the migraines. Okay. Do you wear glasses or contact lenses at all? Only sunglasses. Okay, well hopefully we'll actually have some sunshine soon so you can get to wear your sunglasses. Oh no, the weather's terrible. Okay, so what we're going to do, I'm just going to lean in a little closer to you. Okay, I've got my torch here, and I'm just literally going to be looking in both eyes, okay, with my torch. And I know it'll be difficult because there's going to be a bright light shining in your eyes, but really focus on the tip of my nose, okay? Keep your eyes looking straight ahead at the tip of my nose while I'm looking. I'm just going to have a nice good look with a torch, okay? I'm going to do it once with the lights on, and then I will go and switch the lights off and look, okay? Are you okay with that? Because yeah, okay. Now I have to ask, because some people do have that fear of the dark and things, but okay, so I'm just going to lean in just a bit closer. Okay, just going to look in this eye first. Remember, look straight at the tip of my nose, just there. Okay. Okay. Okay, that's lovely. Everything looks fine. I'm going to now look in this eye, so if you could do the same, please. Just look right at the tip of my nose. Okay, that's great. You're doing really good. Okay, right, so I'm just going to go and turn the light out now, and then I'll be back, okay? I am back. So I'm just going to look in this eye. Just look straight ahead. There you go, that's great. Okay, that's fantastic. And now the other eye. That's great. Let's go and turn the lights on again now. Okay, so what I want you to do now is a little game. We call it a game, and it's called Follow the Torch. Okay, so I'll turn the torch on in a second, and I just literally want your eyes to follow the torch, okay? Follow the light. Okay, you ready? Okay. So wherever that light is, you could just follow there. That's it. You're doing really good. Well done. Okay, that's fantastic. Well, I'm going to do the same again, but with the lights off again, okay? Okay. So, just follow the light of the torch. Okay, that's fantastic. I'll just go and put those lights back on. Okay, I have returned. Right, so I'm just going to write down some notes. Okay, wait 1 second. Okay, that's fantastic. Okay, so what I'm going to do now is your sense of smell. Okay, so I want you to really be honest, okay? If you think you know the smell, just say it, okay? However silly it could possibly sound, just, you know, literally say what you smell, okay? So, are you ready? Okay, I've got 3 different things that I'm going to just hold in front of your nose, okay? I would need you to close your eyes, otherwise you will see what you're going to be sniffing. Okay? Excellent. Your eyes definitely shut, yeah? No peeking. Okay, so this is the first smell. Yeah, it's not a great smell, is it? So what are you thinking? That is definitely correct. Yes, it's ground pepper. Well done. Did that feel like really like a strong smell, or was it kind of like, you know, last minute guess? You knew straight away. You don't like the smell of pepper? Oh no, sorry. We don't use the actual pepper because it would literally make you sneeze. We use the ground pepper. So okay, I'm just going to get the next one for you now. Close your eyes again. Okay. Any ideas? Indeed, it is orange, correct. And you felt, you know, that smell was like really strong, yeah? Yeah. Okay, and the final thing, close your eyes. Okay, so what are you thinking that smells of, please? Some kind of perfume, yeah? Lavender? Yeah, that's what it is. It's lavender perfume. That's fine. Lavender is very good, by the way. You're saying you're having trouble kind of switching off, relaxing and sleeping. Lavender can really, really help with that. So maybe get some lavender drops, put them on your pillow or something. Yeah, it's really, really good for sleep. Okay, so that is the sense of smell done. and the vision test. All we've got to do now is your testing of your hearing, okay, your ears. So what I'm going to ask you to do, if that's okay, is close your eyes again. And the reason I'm doing this is I know your ears are not your eyes, but I always think that if you've got your eyes closed, you will focus more on what you're hearing. And the same, you know, kind of like if you're listening to music, you kind of, you know, you get more of a feeling for it when you've got your eyes closed. That's just my personal opinion. I mean, you know, if you do want to keep your eyes open for this, that's completely fine. But personally, I think it's better if you would close your eyes whilst I do the hearing test, okay? Is that all right? Brilliant. Okay. So what I'm going to be doing, sorry, you don't have to do it yet, I haven't started. So it's fine, okay, it's fine. What I'm going to be doing, okay, is literally breathing in your ear, okay, and I want you to tell me how it sounds, you know, if it's loud, if you can hear it well, or if it sounds muffled in any way. Yeah, okay, so I'm going to do that first in your ears. Okay, we'll do that first, and then I'm just going to be saying some numbers into your ears, and I want you to repeat afterwards which numbers I said, okay? Okay, so if you want to just close your eyes. Yeah, okay. Right, so I'm going to start with the breathing first. Just breathing in this ear first. Okay, and how did that sound? It's quite clear. Okay, I'm going to now try the other ear. And how was that? Okay, so nice and clear, not muffled in any way, no? Okay, that's excellent. Did one ear feel louder than the other, or were they both quite similar? Quite similar, okay. Okay, that's great. So what I'm going to do now is I'm going to do the numbers game. So I'm going to whisper into your ear 3 numbers, basically, okay, and I want you to just tell me afterwards which numbers you heard, okay, and obviously tell me again if they sound nice and clear, okay. We'll do this ear first. 1, 2, 4. Okay, so can you tell me what numbers you heard? Yep. Yep. That's fantastic, and that sounded nice and clear, yeah? Okay. Well, I'm actually going to say a little bit louder now, okay? In the same ear. 3, 4, 2. Okay, so that was just a little bit louder. Yeah? Yeah, that's great. Brilliant. Okay, now I'm going to do the other ear. So start with a nice little whisper and then a little bit louder. 6, 7, 8. I know. I made a mistake. I'm so sorry. I forgot I was whispering. I'll do that one again, yeah? See, look, even us doctors make mistakes. Sorry. Okay, I'm going to try again. Definitely whispering this time. 6, 7, 8. Yeah, that's great. Okay, now I'll speak a little bit louder. Okay. 10, 7, 1. Yeah, and 1. Yeah, that's fine. And did that sound quite clear? Yeah, you can open your eyes now. Yeah, nice and clear. Okay. Right, I'm just going to go and have a little look at something on my system. Okay, bear with me 1 second. Okay, that's fine. Well, that is the end of your cranial nerve examination, and what I'm going to do, I'm going to get all my report wrote up from the tests that we have done today, okay, and then we will be in contact with you. It would, I reckon, I'm thinking within the next 2 weeks. Yeah, okay. I can't say too much, you will have to wait until, you know, the report is fully done, but between me and you, what I've seen so far, you know, and without looking at the test results fully, I will say that I think it's going to be okay. I think everything was working properly, but there are things that I need to look at and do my thing as such, so I don't want to stand here and say, yep, everything's 100% fine, and then, you know, later on find it isn't, obviously. So for that purpose, I must say that it looks okay from what I can see, but you will have to wait for the formal letter version, okay? So if you want to go and wait outside, and I'll be out in a second, okay?